Define heart attack. A heart attack, or myocardial infarction, is a medical term used to describe the death of a portion of the heart muscle due to an interrupted blood supply caused by a blockage in a coronary artery. The lack of sufficient blood flow deprives the affected area of the heart muscle of oxygen and nutrients. A heart attack can be a life-threatening medical emergency and requires prompt medical attention. Types of heart attack and their pathophysiology. There are two main types of heart attack, each characterized by specific features and underlying causes. 1. Angina. And 2. Myocardial infarction. Angina is further divided into stable and unstable angina. Stable angina, also known as angina pectoris, is a type of chest pain or discomfort that occurs when the heart muscle does not receive enough blood and oxygen to meet its increased demand during physical exertion or emotional stress. Unstable angina. Unstable angina is characterized by chest pain or discomfort that occurs at rest or with minimal exertion and represents a change in the pattern or severity of angina. Unlike stable angina, unstable angina is considered a medical emergency as it indicates a higher risk. Now comes myocardial infarction, or MI, which is further divided into 1. ST elevation myocardial infarction, STEMII, and 2. Non-ST elevation myocardial infarction, NSTEMI. STEMI is the most severe and life-threatening type of heart attack. It occurs when there is a complete blockage of a coronary artery, usually due to a blood clot forming on top of a rupture. The blockage leads to a prolonged interruption of blood flow to a specific area of the heart muscle, resulting in extensive damage. NSTEMI is a type of heart attack that occurs when there is a partial blockage or temporary blood clot in a coronary artery. The blockage may not completely obstruct blood flow, but it still causes damage to the heart muscle. But if you ask what is the difference between both, so the distinguishing factor between NSTEMI and STEMI is the absence of ST segment elevation on an electrocardiogram. The key difference between angina and myocardial infarction is angina is characterized by temporary episodes of reversible ischemia without causing permanent damage, while myocardial infarction involves sustained ischemia, leading to irreversible myocardial injury and cell death. Risk factors. The risk factors and causes of a heart attack can be categorized into two main groups: modifiable and non-modifiable factors. Non-modifiable risk factors. Number 1. Age. The risk of heart attack increases with age, and the incidence is higher in individuals over 45 years. 2. Gender. Men generally have a higher risk of heart attack than premenopausal women. However, the risk in women increases after menopause, and the risk becomes comparable to that of men. 3. Family history. A family history of premature heart disease in first-degree relatives such as parents, siblings increases the risk. Modifiable risk factors. 1. Smoking. 2. High blood pressure. 3. High cholesterol levels, high levels of low-density lipoprotein, LDL, and triglycerides, and low levels of high-density lipoprotein, HDLL. 4. Obesity and overweight. 5. Physical inactivity. 6. Diabetes mellitus. 7. Unhealthy diet. 8. Stress. Chronological overview of the clinical presentation of a heart attack. Initial symptoms. 1. Chest discomfort. First, the person may experience chest pain or discomfort, often described as a tightness, pressure in the chest. It can feel like an elephant sitting on the chest. Pain or discomfort may radiate to the arms, typically the left arm, jaw, neck, back, or stomach. The pain may be intermittent initially and prolonged, persisting for 20 minutes. 2. Shortness of breath. Individuals experiencing a heart attack may have difficulty breathing. 3. Sweating. Profuse sweating, often described as cold sweats, accompanied by additional symptoms such as nausea, vomiting, lightheadedness, or dizziness. Person may become unconscious totally afterwards. Tests. Tests that are typically performed in the initial assessment of a suspected heart attack include electrocardiogram, called as ECG or EKGG. An electrocardiogram is usually the first test conducted in a suspected heart attack. It records the electrical activity of the heart and can quickly help diagnose a heart attack. The ECG can identify characteristic changes in the heart's electrical pattern that occurred during a heart attack. This test is relatively quick and provides immediate information to guide further management. Blood tests. Blood tests are performed to measure cardiac enzymes and proteins that are released into the bloodstream when the heart muscle is damaged. The most commonly measured markers are troponin, creatine kinase, CKE, and CK-MB. Elevated levels of these markers indicate heart muscle injury and are suggestive of a heart attack. Furthermore, other tests can be performed once patient is stable enough. Like chest X-ray, a chest X-ray may be conducted to assess the heart, lungs, and surrounding. Management at hospital. The emergency treatment of myocardial infarction typically involves the following steps. 1. Administering aspirin. If a heart attack is suspected and there are no contraindications, emergency medical personnel may instruct the individual to chew an aspirin tablet, usually 325 mg. Aspirin helps reduce the clotting ability of blood and can help improve blood flow to the heart. 2. Oxygen therapy. In some cases, supplemental oxygen may be provided to ensure that the body receives an adequate amount of oxygen. 3. Medications. Upon arrival at the hospital, healthcare professionals may administer medications to help relieve pain, stabilize the heart, and prevent further complications. Medications commonly used during a heart attack may include 1. Nitroglycerin to improve blood flow. 2. Antiplatelet drugs to prevent clot formation. And 3. Thrombolytics or anticoagulants to dissolve or prevent blood clots. Now continuing the management. 5. Cardiac monitoring. The person's vital signs, including heart rate, blood pressure, and oxygen saturation, will be continuously monitored. Electrocardiography, ECG, will be performed to assess the electrical activity of the heart and determine the extent of damage. 6. Reperfusion therapy. Reperfusion therapy is aimed at restoring blood flow to the blocked artery as quickly as possible to minimize heart muscle damage. It can be achieved through two primary methods. Percutaneous coronary intervention, PCI. This procedure involves using a catheter inserted into the blocked artery to mechanically open it and restore blood flow. It may involve the use of stents to keep the artery open. Thrombolytic therapy, in some cases where immediate PCI is not available. Clot-dissolving medications known as thrombolytics or fibrinolytics may be administered intravenously to dissolve the blood clot causing the heart attack. This therapy is time-sensitive and is typically administered within a specific window after the onset of symptoms. Follow-up treatment. After you leave the hospital, you may feel weak or a little depressed or anxious. This is common, and your medical team will work with you to help overcome these problems. Often, this involves lifestyle changes and medications aimed at reducing your risk of another heart attack. 1. Lifestyle. Changes in lifestyle, such as dieting, quitting smoking, and losing weight, can help you reduce the risk of a repeat heart attack. You should talk with your doctor about an exercise plan that is safe for you. In some cases, your doctor may recommend that you take part in a formal cardiac rehabilitation program, which provides exercise training and counseling. 2. Medication. After a heart attack, your doctor may recommend that you start taking medication to help reduce your risk of heart attack and improve cardiovascular function. These could include aspirin or anticoagulants, beta blockers, calcium channel blockers, or CE inhibitors.